Defining social determinants of health, that question really invites clinicians, educators, researchers to embrace a broad understanding of health in the social context, beyond perhaps narrowly defined or focused biomedical factors. So it really is defined as situations or conditions that are taking place in daily living, impacting a broad range of health outcomes, functioning, quality of life. Despite the fact the social determinant of health impacting really broad range of health outcome and a crucial matter, but there are huge challenges for many healthcare organizations are facing. Specifically, it is very hard to properly measure and apply the social determinant of health data to healthcare delivery and research. The underlying cause for this problem is really the unavailability of more reliable, more accurate, and even scalable, the individual level social determinant of health measure. So our group tried to tackle on this roadblock to national effort for improving health equity. We addressed this problem by developing and implementing and applying the index, so-called Houses Index Platform, which is derived from the assessment data, meaning real property data for individual housing unit. So this data is publicly available for property tax purposes. So we made it now is available through a cloud system. So it's available is really to anywhere, anytime, so that this is going to be really a scalable solution for really overcoming the absence of individual level socioeconomic measure and social determinant health measure. There are a couple of use cases we can think of in improving health equity. One potential use case is that this Houses Index Platform can help healthcare organizations to identify and help those in need of social determinant health addressing services, such as financial help. This is going to be particularly helpful for healthcare organization and patient as well. If you can deliver some healthcare services anticipating major medical expenses such as transplantation and oncology treatment, you want to know ahead of time, and you can actually, provide perhaps a pre-treatment, social support in place before you begin it. The platform may help the healthcare organization to monitor the change of social determinant health over time in the population they're serving, so that, for example, COVID-19 pandemic, what's happening to our patient population? How are they doing? So this is going to be really very helpful for the system level planning. That's sort of a very concrete example for how they can help. Lastly, this is going to be more related to Mayo Clinic Platform. So Mayo Clinic Platform and our lab collaborated. We actually they applied Houses Index to identify and actually detect AI bias, model bias. So that meaning that we found that the children with lower socioeconomic status measured by Houses Index, they had a much poorer machine learning performance in predicting asthma exacerbations compared to those with high socioeconomic status. And then we looked at it, where is this sort of biases are coming from? It turns out to be the children coming from lower socioeconomic background, they had much more prevalent missing data, meaning data incompleteness. Second one is inaccuracy, meaning even if group of children who met the asthma criteria but do not have asthma diagnosis, so that is going to be preventing them from then accessing preventive and therapeutic interventions, right? So this is a really, to me, sort of a kind of open up potential for Houses Index for AI work. So now that we are collaborating, we try to develop some framework and a method and tools for efficiently identifying and mitigating this AI bias by socioeconomic status. Platform collaboration helpful is that we are scientists, we are very good at sort of doing discovery science and translational science, but not necessarily implementation, dissemination science. We are really relying on the Mayo Clinic platform sort of a delivery mechanism. How can we really making these useful tools and technology to users? The users are those ones really kind of bringing impact, right? Not necessarily us. So this is a sort of where we are collaborating closely, and we like to see happen sooner than later.